Okay, so today we will be talking about lumbar puncture and epidural anesthesia, which is very high yield and basic. Okay, so here we go. When a lumbar puncture is performed, the needle enters the subarachnoid space. For better understanding, let's go to some of histologies. Okay, so this is skull, this one is dura mater, arachnoid mater, and pia mater. In between the arachnoid mater and pia mater, we do have a space which is called subarachnoid space. And actually, this is the place where we insert the needle to extract the cerebrospinal fluid. But I got a question for you. Why we do lumbar puncture? Very good. We do lumbar puncture for the diagnosis of diseases, that is multiple sclerosis, syphilis, meningitis, infection, malignancies. Okay, we do lumbar puncture in case of reduced cerebrospinal fluid. We do lumbar puncture to administer medications or chemotherapy directly to spinal cord. Okay, so if we talk about the likely anatomical location for this procedure, so the needle is usually inserted between L3 and L4 or L4 and L5. L4 and L5 is more specific than L3 and L4. And this is level of horizontal line through upper point of iliac crest. This is the highest point of iliac crest, and this is horizontal to the anatomical location. Alright, so before you do this procedure, you should keep something in your mind. The patient should be examined for signs of increased intracranial pressure. I'm stressing here, LP, lumbar puncture, is contraindicated in case of increased intracranial pressure. Yeah, because the cerebellar tonsils may herniate through the foramen magnum. Okay, so the cerebellar tonsils, they may herniate through the foramen magnum. So we should keep in mind that lumbar puncture is contraindicated in case of increased intracranial pressure. Okay, so if we talk about some anatomical landmark or some important layers, so this one is skin. We got fascia here, and the anatomical landmark, that is supraspinous ligament, interspinous ligament, and this one is ligamentum flavum. And finally, we are here in the subarachnoid space. And this is between L4 and L5. Okay, so if we talk about positions, so we got two positions. The one is lying position and another one is sitting position. Lying position is like lying on side with feet drawn up and head lowered to the chest. And sitting position is sitting on side of bed, leaning on stationary overbed table, feet supported on a flat surface. Okay, if we talk about the nursing action, and this is also very high yield, that how do we prevent post-lumbar puncture headache? Okay, we should keep the patient flat supine for 4 to 8 hours. Okay, and that flat supine position will help you prevent post-lumbar puncture headache. And then avoid elevating head for 6 more hours. Okay, I got some more questions for you. The physician plans to perform a lumbar puncture, which is also called spinal tape, to confirm the diagnosis of meningitis, inflammation of meninges. The nurse should place the client in which position? Very good, side-lying position with his neck flexed. The client is typically positioned on his or her side with neck and knees flexed to increase the space between the vertebrae. Okay, this will help you to increase the space between the vertebrae. Which nursing intervention is most appropriate after lumbar puncture has been performed? Very good. Keep the client flat for several hours. Okay, doctors, I got a question for you. The question is, a neonate present with fever. It is noted he is very irritable and a sepsis workup is initiated. CSF needs to be collected. What is the likely anatomical location for this procedure? Very good. Between L3 and L4 or between L4 and L5. I told you L4 and L5 is more specific position than L3 and L4. Okay, so the next question is, what meningeal layer? Very good, subarachnoid space. Subarachnoid space. Okay, so that's all for today, and thanks for your cooperation and teamwork. I hope cooperation and teamwork will get us far. Thank you so much.